What is like the main way to prevent skin cancer? I know sunscreen is a big thing.
That's number
So just don't skip the sunscreen.
exactly. A lot of our patients right now in their 60s, 70s, they were born, they grew up in the generation where sunscreen wasn't a thing. Their parents never told them to do it. So I hear it at least every 5 times a day. I used to lay out in the sun with the reflector, baby oil. And now, sure enough, 30, 40 years later, they're coming in with growths popping up all over them. So yeah, sunscreen, and just, you don't have to avoid the sun. You just have to be smart about the sun. Just don't go out too long without sunscreen.
Do you have like, I guess, a brand you prefer or an SPF that most people should be using? Or let's get some specifics on what kind of sunscreen that people should be.
Yeah, I would say at least SPF 40, and you want to reapply 2 to 3 hours. I would reapply. In terms of brand, there's a million brands of sunscreen out there. In the office, we carry a brand called Elta MD that patients like. It's more cosmetically elegant. It doesn't leave that white residue, that white paste. But yeah, there's tons of brands. But most people forget to reapply, especially if you're out for a while.
Yeah. So dermatology has this reputation of being a very cush specialty. So in that reputation, what's the most difficult part of your job?
I mean, compared to orthopedic surgeon, it is a lot more on the cush side. But dermatology it can be whatever you make of it. There's physicians who work 1 day a week, part-time because they have a family to take care of or whatnot. But it depends how many patients you want to see too. So our practice, we're very high volume. So in that sense, it's not cush because we're treating a lot of patients in a short period of time. As soon as you walk in the room, your brain has to start thinking about the diagnosis and the treatment plan, all while the patient sometimes is telling their life story. So, but we got to treat them right away. But were you asking what the challenging part is?
Yeah, what your most challenging part is.
Yeah, I think so. I think the best part is the patients, and sometimes the worst part could be one troublesome patient. I mean, our practice, we're fortunate to have, really amazing patients that we've grown with over the past 10 to 20 years. But, sometimes there's patients with unrealistic expectations. They expect their chronic disease of 20 years to be able to be cured right away in one visit. So we have to set those expectations. The other challenging part, I think, of being a physician in general is dealing with insurances, trying to, get the right medication for the patient or the right procedure approved for the patient. Whereas like some admin, who's never seen a patient in their life is making these decisions for you. So that's challenging as well.
Yeah. Insert like recent news event here.
United Health. Yeah. Forget.
Thank you so much for listening. I hope you enjoyed. If you don't mind, please leave a like and subscribe. And with that being said, see you in the next one.